The choice we all face now is what we will do as we move toward the fall and winter phase of COVID-19 in Toronto. There is no question that we will see resurgence.
Now that we're into September, Canada, a number of public health officials across the country are beginning to warn against not just a second wave of coronavirus cases flaring up, but a second lockdown, bringing further shutdowns across the country, taking us back to where we were several months before. Can this possibly be? Is this serious? Well, yes, according to Dr. Eileen de Villa, Toronto's Chief Medical Officer of Health, she said, well, everything has to be on the table, and who knows? Maybe we will have to return to some degree of a lockdown. What is she talking about? Like things were in March when suddenly it all closed down? Are we talking about just stepping back a little bit from where we are right now? Maybe, I don't know, the movie theaters are open, but they will not be reopening if whatever the evidence shows that they have caused some sort of cases to flare up. Is that what she's talking about? Or is she just saying all of this as a threat to make a lot of Canadians who are perhaps not taking this as seriously as they should be to wake up to things and get a little scared, to practice the mask wearing more, the social distancing, and the enhanced hygiene? It's hard to believe that we could be in a second lockdown, that it could be necessary, because throughout the past number of months, we have had a lot of experts step forward and say there are some secondary health problems that we have to start talking about. How people were not going to 911 for heart attacks. How so many necessary surgeries have been delayed. Provinces are dealing with backlogs of them. A lot of pediatric experts stepping forward and saying, we have to reopen the schools, address the risks, mitigate them, yes, but the kids need to return to school for their own well-being. And of course, all those economic minds who are stepping forward saying, look at the cascading effects, some of which we are still only really starting to see in terms of troubling mortgage defaults and more. So I guess one of the questions isn't just, do public health officials want to see a lockdown? Will they say we need to see a lockdown? But will the Canadian people accept one? Will you accept one? A second wave will bring its challenges, and we all must be prepared to handle them. But we have to talk about what are the numbers that we deem acceptable. The original purpose of the first lockdown was so that we did not overwhelm the healthcare system with people who needed to be in ICUs, people who needed ventilators. Well, not only have we scaled up the equipment we have, but we succeeded in that goal. Therapeutics have improved such that, thankfully, people who get the virus seriously and severely, well, they are not as likely to die of it now as they were back when people were first battling this. And a lot of the cases that we see upticking, it's not good to see cases increase, but these are not from the higher risk groups. They are from younger people. So what do you say? Would you accept a second lockdown? I don't think most people would. As much as they want to take this seriously and they want to deal with things and beat back the virus, they still want to keep society and the economy open.